In progress.
So now starting, as I have mentioned already in my previous lecture, that before you study for any station or before you start preparation for any kind of station, you should have a rough structure of approach of medicine stations in your mind. The idea behind the thing is actually when you have a rough approach, like when you know that where you need to ask which question and what is the sequence of that question, that this approach is going to help you in the way that sometimes the in the real exam the stations are very tricky. So if you follow the exact approach, you won't miss anything. All right, so by learning the approach, what we do is we actually increases the chances that by asking all relevant questions we might reach the diagnosis even if we do not know anything about the station, because there is a chance that sometimes in the exam the station might come that you are not familiar with it or you haven't heard about that, or the station you have actually learned about it but you are unable to recall it. So that's always advisable, that always have a rough approach, that how to approach a medicine station in your mind. All right, and then learn to de-learn the approach. So the second thing is always learn to de-learn the approach. By that I means that if you always rely on the approach, you should not be sounded scripted, because if someone sounds scripted and if even he knows each and everything of the station and he deals or tells everything related to that station to the patient, the candidate might not pass. Because I have seen a lot of cases that sometimes like a few people say that we have said in the exam each and everything related to that station that was mentioned in the notes, but still I failed. But sometimes there are a lot of students who just have followed the approach, and even if the station was very new for them, even if they were unable to reach to the proper diagnosis, they have passed the station. I have seen a lot of examples during these days. So always first of all learn the exact approach, then learn to de-learn the approach. For example, you should know that this is my basic approach, but I should know according to the circumstances, according to the situation, according to the scenario, I might have to change the sequence, or I might have to ask a few questions before than that of the section that is actually mentioned in your approach. All right, so starting with the gynae. So first of all, as you all are familiar that in the gynae, first of all, you should know that what areas are very important in the stations related to gynae. The important areas are menstrual history, sexual history, contraceptive history, family history, and history related to smoking or alcohol consumption. So these areas, and also very important, any present symptom, any presenting symptom, for example if she is having. So these 5 to 6 things are actually the, you can say, the key points or the key areas you are supposed to cover in all the stations related to gynae and obs. All right, but definitely once again you might have to change the sequence according to the scenario they have given you. All right, so starting from abnormal vaginal discharge, as you know, in the females it is very common to have infections, but it can be an STI or it can be a non-STI. So you should know that which one is STI and which one is non-STI. All right. So first of all, just for a quick review of yours, I have just provided you with this table. Like the non-STIs are basically who comes in the scenarios are 3 types: bacterial vaginosis, yeast infection, and trichomoniasis. You should know which color. For example, if the scenario comes related to any of these, they will give you proper history. They will give you proper like clear problem. They will mention that the patient is actually having grayish white discharge and it is non-itchy, or they might say that it's a curdy white discharge, or they will mention that it is foul smelling and the discharge comes when she is done with the sex, like right after the sexual activity she is having a greenish foul smelling discharge. So you have to learn them. And also you should know that all the non-STIs, they still the having sex with the multiple partners or having a new partner in life can provoke these infections. No doubt these are known STIs, like these are known sexual transmitted infections, but still sexual activity with more than one partner or having a new partner can trigger this. All right, we will discuss it later on how. All right, so For the other, like now talking about the STIs, actually regarding STIs, it is very common that the scenario they will give will always come like PID, pelvic inflammatory disease. All right. So the two infections that are common to come under STIs during your PLAB stations are chlamydia and gonorrhea, and we will discuss them later on. All right. So first of all, as I always say that whenever a scenario comes in front of you, you should know, you should learn the basic points like where are you? Are you in emergency department? Are you in a GP clinic? Or are you in obs and gynae department? All right. And the second thing is, with whom you are talking, like is it patient or is it the relative of the patient? So you should know the key areas and also read your task carefully, like is it her first follow-up visit, is it her first visit, or is it a follow-up visit? Because by having look on these points, your scenario might be changed a little bit or your approach might be changed a little bit. So you have to know that where you are, with whom you are talking, and is it her first visit or her follow-up visit, and then the wordings of their task, like what they are asking you to do. For example, in the task they might say take a focus history, discuss the management. They might say talk to the patient and address the concern. So you should know that you are supposed to cover all the three areas, like history taking area, IPS area, management area, but you should know according to the wordings of the scenario, your importance might be different. For example, they have mentioned in the scenario, they talk to the patient and explain the results to the patient. No, without any doubt, I'll take the history, I'll discuss the management, but they have clear cut explained that what they want from me is they want me to explain it. So my priority would be to explain the results thoroughly and to address the concerns. So by doing this, I will prioritize. Secondly, as we already know that you all have passed PLAB-1, mashallah. So you all know each and everything of the station, and you all are studying from somewhere, and all the notes are very good. So the only basic thing that's going to make a difference is what knowledge you are giving to the patient and how you are delivering this knowledge to the patient. So please, from the very start, whenever your exam is focused on these, be focused on these areas, like how to deliver, when to deliver, and how much to deliver. Okay, so starting from the basic approach, same if the patient is here for the first time, you always have to keep a smile on your face and introduce yourself. For example, hello, let her reply. My name is Dr. Hamid, or my name is Dr. Hera, one of the FR2s in the GP surgery, and then ask that let me ask your name and age, so she will, or let me confirm your name and age, and then ask her if is it okay if I call you Smith, or is it okay if I call you Sarah, whatever her name is. Okay, and then proceed. And then if it is the first visit, you have to ask, how can I help you, Sarah? All right. But if it is the follow-up case, you are supposed to paraphrase. Like, for example, whenever the follow-up case comes, it always has a back history of, for example, she might has appeared in the GP surgery with some complaints and a few tests were already done. All right. So you have to paraphrase that. Well, I can see from your notes that you have visited us before and you had these symptoms. If the symptoms has been mentioned in your scenario, then otherwise simply say that you have visited us before and I can see that we have done a few tests on you. Has anybody explained the results with you? She might say no. By asking this question, has anybody explained the results to you? You are actually engaging the patient. You are actually building a rapport with the patient. That is very important. That is a part of IPS. Okay. And then you will say, well, I will explain the results in a while, but let me just ask a few questions so that I can be in a better position to explain what's going on. Is it okay for you? All right. So always at every point, engage the patient. Try to engage the patient at every station, every point. Okay, so if the visit is follow-up visit, you have to ask 4 questions. Always make it a habit. What questions are? what was the reason of your first visit? But again, if the symptoms has already mentioned, and if you have already mentioned while paraphrasing that you presented with this symptom, do not ask this question again. But if you haven't mentioned in the paraphrasing, ask the question. What was your reason of why you came in the first place to the GP surgery previously? What investigations did they on you? What you were told about that, and what treatment they have offered to you? All right. And then if okay, so now according to the symptoms, for example, if the presenting complaint of the patient is pain, you have to cover topa, the thing that the Dr. Hamid has already mentioned, like when did it start, what were you doing when it started, was it sudden, non-pain symptoms, because most of the time the obstetricians comes with like discharge, he's just having discharge, or just whitish discharge, or just a few concerns. So you have to start with topa, or if the symptoms are pain, then you have to start with ST topa that Dr. Hamid has already told you in the medicine station. So I'm not going to that because otherwise that might take a little bit more time. All right. So regarding the discharge, for example, the patient is having discharge, you have to ask these questions. Topa, like when did it start? What were you doing? When it started? Like, because this question is important, that has it started after the sex, or has it started like after you had periods? Because it is related to it somehow. So was it started suddenly or gradually? By that I means, like, if you are having discharge, how did it started? Like, why in the start the discharge was very small and then it has increased in quantity? By that you are actually supposed to ask this question as well. And the next question would be, now it is continuously you are having this discharge, or it comes and goes? Has this worsened? Has this got better or stayed the same? And then ask, have you noticed anything that makes it worse, or has there anything that makes it better? Okay. Just give me 2 minutes. All right, then there are some extra questions that you should not miss them, because all the DDs that will come around regarding the vaginal discharge will, you will be able to identify the exact cause by asking the further questions, like, can you please quantify it, like how much you are just how much the discharge is, and what is the color of it, what is the order of it, is it consistent or it is related to your periods? Okay, because that is important. You are supposed not to miss any point from these four, like quantity, color, order, and is it consistent or it is related to your periods, because sometimes most of the infections that are non-STIs are most probably related to the period. So you have to ask these questions. You might you can miss the other, like top up questions, like when did it started and how did it started, is it getting worse? You can skip these questions if you are lacking in time. But color, order, and is it consistent or related to your periods, these questions are very. And then you have to ask further questions, like, do you have any itching, do you have any other symptom? Like, now afterwards comes the red flags. What could be the red flags for the vaginal discharge? For example, if the patient is having vaginal discharge, then that means she must be having some kind of infection, but we don't know what kind of infection it is. So we have to rule out the red flags. What are the red flags? She can have PID, like pelvic inflammatory disease. So do ask, do you have any lower abdominal pain? Do you have nausea, or have you noticed any bleeding as well, or any unusual bleeding as well? So whatever you want to ask, you can ask. Then you have asked up till now, you have asked all the questions related to the discharge, like when did it started, how did it started, what is the color of it, what is the order of it, and the associated symptoms like nausea, vomiting, bleeding, and lower abdominal pain. And then what will come is, you at that point you must know that there is something problematic with the female. She is having discharge. Now you have to know, why is she having this discharge? You should know the cause, like why is it so? Because by knowing the contributing factors, you would be able to identify that it might be STI or it might be non-STI. Okay, so you have to ask the contributing factors as well. The contributing factors are sexual history. You should have asked a few questions. Are you sexually active? If she say yes, then ask if you are in stable relationship. If she says yes, then simply ask, is your partner male or female? But if she says no, I'm not in a stable relation, then ask, how many partners do you have? All right. And are your partners male or female? Do you practice safe sex? she might say, what do you mean by safe sex? So to be on a safe side, just to save your time, ask in one line, do you practice safe side by sex? By that I mean, do you use condoms? All right. And also ask, what is your preferred route of sex? One thing more here is very important. If this is actually related to lesbian station, so you have to ask, if her partner is female, you have to ask, do you use toys? Okay. And when you use toy, do you also use condom? Because that is important question there, if the partner is female, otherwise not. Then you have to ask, like, do you use vaginal joaching? And do you have you had bubble bath? Because a bubble bath and use of some kind of chemicals while shower, or some kind of use of some products on these pelvic areas, that are actually a causal factor for the non-STI. So you have to ask these questions, very important, because in your practice you will two questions are actually related to the history, that patient was actually doing bubble bath, was actually taking bubble bath, and that's why she actually developed the symptoms. All right, so you have to ask these questions. So what are the contributing factors, people? Sexual history, vaginal joaching, and use of bubble bath. Then you have to ask the menstrual history. Why you are asking the menstrual history? Because you should know that if it is related to her periods, and if she is not maintaining her hygiene. So you have to ask the menstrual history as well. Like, are the periods regular? Are they painful? Just 2 or 3%. That's it, not much. And then contraceptive history is important here. Contraceptive history, why is it important? Because if the person is, if the patient is using condoms, then that means STI might not be differential. But if she is not using that, she is at the risk of STI. So you should ask this question, like, which contraception you are using, and for how long you have been using this, and are you having any side effects? Are you okay with that? Okay. And you do ask these questions, like, in a very friendly way. Okay. And then comes the rest of the part, like PMMA. Do you have any previous medical problem? If it is important here, then are you using any medications? Do you have any other long-term problem? Are you allergic to anything, like latex allergy or anything? Because in a lot of females, if, for example, the condom or the use of a diaphragm, they might not be able to use them because they might be allergic to the material. So you have to ask the allergy history here. That is very important. You should have asked about that. Do you have any previous stays, or you have any previous history of the similar incidences, or any previous sexual transmitted infection history? Do you have any particular disease that runs in your family? And then you can skip DESA if you want to, if it is not very related to that. Otherwise, but to save your time, but you can cover that. It's totally up to you. There is no hard and fast rule. You can skip it. It depends on your own. And then again, the travel history is very important. Occupation is very important. Where do you living is very important, and how it has impacted on your life. Now, the question of how it has impacted on your life. Some people, as they sound scripted, even if the patient is having a history of just 2 days, they will ask how it has impacted on your life. You should know that if the history is very acute, it must not have impacted her life. So I'm not supposed to ask the question, has this impacted on your life? That sounds silly. So if the history is chronic, like 1 to 2 weeks, then ask, like, how this has impacted on your life. But if the history is very short, you're not supposed to ask this. So common sense. All right. So afterwards, the most important thing is, you have to ask, do you have any particular concerns? Because in each and every task, the patient or the interlocutor that will play a role as a patient, they have been provided with the questions that they are supposed to ask from you. They have a few concerns always. So always make it a habit to ask, do you have any particular concern, or is there anything you are worried about? Or sometimes the patient might not say anything, and by the body language you can see that I can get a clue that my patient is really, in a trouble. She is not smiling. She is in some kind of trouble, or she is in kind of stress. So you should ask if she seems to be worried. Otherwise, do not make it on your own. Okay. So do ask, you seems a little bit worried. Do you have any concern? Okay. So that would play a very important role in your IPS, people. So always have a look on verbal and non-verbal clues. Act like you are in a real setting and you are a real doctor. I mean real doctor by that I means like you are in a real setting and the patient is actually a patient of yours. Okay, and you are sitting in a real clinic. So always keep this thing in mind. That's going to have a very good impact on your performance during the exam. Okay, so the next question would be OET, like observation. You have to check BP, pulse, temperature, respiratory rate. You have to examine the patient. Like, what will you do? What will you say? Well, Sarah, I would like to check your blood pressure, pulse, temperature, and respiratory rate. And I also need to do your abdominal examination and your pervaginal examination. And I'll be gentle and I'll maintain your privacy. And there will be a chaperone with us. But what do you think about that? Is it okay for you? Okay. So you have to tell her, you have to take the consent and you have to engage the patient here. Okay. And then the tests, what test you can do in OET, like before the management part, what test you can say are those that can actually be done on the bedside. Like in gynae and obstetrician, the test that we can do are urine dipstick and pregnancy test. Okay, so according to the scenario, you should have asked the test that you need to see. So always keep one thing in mind. If the patient is having vaginal discharge or having some kind of symptoms or having vomiting, nausea, you should do urine dipstick and pregnancy test until and unless they have already said that the test already have done. Otherwise you should have asked, because if you do not mention the test, examiner will not give you the page or something about the test. So you should ask them. And also, if you do not mention the examination, the examiner will not give you any kind of picture or any kind of clue. So you should have mentioned it. They won't ask you to do any examination, but you have to mention it, and they will just give you a page in which all the answers related to your examination or test would be given. That will help you to reach to the diagnosis. And then comes the management. What is the management? You have to disclose a diagnosis if it is related to something that you are supposed to identify. Otherwise, if it is a simple consultation, you should have just explain anything that is related to your scenario. And then you have to decide, like either you are going to admit the patient or you are going to discharge the patient. You should tell them in the very start. Okay, or either you are going to refer the patient. And then if the case is very critical or something very serious or something important, always involves the senior. Like what will you say? For example, Mr. ABC, your diagnosis is this based on your sign and symptoms, and for this I'm going to refer you to this. I will also discuss it with my senior. By doing this, you are going to get 2 marks. Okay, so always involve the senior when the case is important or very different. Okay, and then again, if you want to send them more, it's totally up to the scenario. And then targeted management, like if some more tests you are going to do, some treatments. For example, what treatment could be could you give? Like for example, if you are starting the patient on medicine, do not say I'm going to start you on beta blockers, that is this. No, never. Always say, well, we need to start you on a medicine to control your heartbeat, or we need to start you on some medicines that will kill the bug. Like by that I means the antibiotics. So you can simply say, well, we are going to start you in antibiotics. Actually, these medicines will help to control the symptoms. So until and unless they won't ask the name, do not tell the medicine's name on your own, because that is extra thing. You are not supposed to, because the patient is not going to remember the name. All right. So, and then the long-term management, if it is any. For example, in any gynae and OB stations, always make your 3 to 4 points or 5 to 6 points, like do's and don'ts. Whenever a patient is having discharge, there are some do's and don'ts that I will mention, that I scenarios later on, and I have taken them from the NHS side. Okay, because on the NHS side, they have given them wonderfully in a very easy language, in a layman language. So you always in the gynae and OB stations, like in the OB station, when gynae stations, I'm really sorry for, because I'm keep on mentioning OBS. It is not OBS, it is gynae station. So whenever the patient is having any kind of discharge, you are mentioning the management related to vaginal discharge, make it a habit to mention the do's and don'ts, because these are part and scenarios. And then safety netting, again, in all the gynae stations related to the vaginal discharge, what could be the safety netting is symptoms related to PID. So what are the symptoms related to PID? Same, lower abdominal pain. That's it. Okay. And then if you are admitting the patient, not offer leaflets, people. That is a big blunder. People do, I'm going to admit you, and also here are the leaflets. If you are admitting the patient, there is no need to give already admitting the patient, no need of that. Okay. And then afterwards, anything remaining, if the patient has mentioned some months previously, you have to address them here. Okay. So that's it. That is the rough approach. So what is the approach, people? We should revise it here. So first of all, we have to identify first visit or follow-up visit, then history of presenting complaint. Like if it is a discharge, ask the pet questions. When did it started? And is it getting worse over the period of time? Have you noticed anything that makes it worse? Have you noticed anything that makes it better? And what is the color of it? What is the odor of it? And is it consistent, or is it related to your periods? And do you have any other symptoms? For example, nausea, or have you noticed any blood coming out of your vagina? All right. And is it itchy? Have you noticed any blisters, any lesions around your vagina? Okay. And then the red flags come. Like, do you have any lower abdominal pain? Okay. All right. So one, and also always, and also then same sexual history. You have to see that what questions you are asking. You should not be reluctant. That some people say that if you don't mind, I need to ask a few questions related to your sexual history. No, not at all. Do not say this. It's fine. Just simply ask. Well, I need to just ask the questions. Just I need to ask a few questions and then simply ask, are you sexually active? It's totally fine. There is no such kind of thing that you do not ask you cannot ask us sexual questions directly. No, not at all. Okay. All right. So let's discuss the scenarios. First of all, so we're stations. Okay. So the first station is the pervaginal discharge, which is candidiasis. So the scenario is you are referred to in GP surgery. Catherine Ford, a 45-year-old, has come with some concerns. Please talk to the patient, address the concerns, and discuss the management. Now, where you are in the GP surgery, and your patient. Now, patient info is the patient is you have had whitish vaginal discharge 2 weeks back, and it is itchy. You are sexually active and in a stable relationship. You practice safe sex and use condoms. Never had cervical smear and worried it could be cancer. LMP was 6 by 52 ago, like almost 1 week back, and partner has no symptoms. Symptoms are persistent, and now the patient concerns are: is it cancer of the cervix? Will I get better? And is it sexually transmitted infection? So people, any of you want to practice, please do practice, do participate. No one is going to judge you, because I have already discussed the rough approach, and you're just supposed to follow that approach. That's it. So please, because if I keep on like dictating you people, that's not going to help. So anybody wants to practice this scenario? Hello? Or you want me to pick from out? I will. Okay, Hera, you can unmute yourself.
Okay.
Hello.
Hello, ma'am.
Hi, Hera. Okay, so Hera, let me just start the timer for you. Just
Okay, ma'am.
a second. Okay. All right. And your time starts now. I'm going to give you 6 minutes. Okay. Your time starts now.
Okay. Hello, how are you?
Hi, doctor. I'm good.
My name is Dr. Hirali. I'm one of the junior doctors here. Can I know your full name, please?
Sure. My name is Catherine Smith.
Catherine Smith. And what would you like me to call you, Catherine?
You can call me Kathy.
Okay. Nice meeting you, Catherine.
Same here.
How can I help you?
Well, actually, doctor, I have some personal problem, actually.
Okay. Yes. Go on. You can tell me. No problem.
Okay. So actually, doctor, I feel like I'm having some kind of weird discharge coming out of my vagina, and it's been there for the last 2 weeks.
Or all right. Don't worry. I know it must be unpleasant for you, uncomfortable for you, but don't worry. You can discuss with me. Would you like to tell me more about it, please?
Like what, doctor?
Like, for how long has it been?
Well, it's been there for the last 2 weeks.
2 weeks. And how did it start? Was it sudden or did it start slowly?
Like in the beginning, it was not much, but with the passage of time, I think it is getting worse. Like I'm having discharge more often now.
All right. And has it been continuous or does it go and come?
Well, it is continuous, like it's always there.
All right. And has it worsened since it started?
Well, yes, doctor, it is getting worse.
All right. Oh, don't worry. I'm sorry for that. And does anything make it worse?
Doctor, I don't know.
You don't know. Okay, no problem. And anything makes it better?
Still, I haven't tried anything because I'm kind of very shy and I'm very reluctant to share this with anyone.
All right. Don't worry. We're here to help you. And does the discharge, could you quantify it for me? Is it a spoonful or a cupful? How much?
Well, honestly, in the start, it was just a kind of teaspoon, you can say, but now it's a kind of much.
All right. And what is the color exactly? Could you
It's
describe the color
white,
for me?
curdy. It's whitish.
White curdy. And is it foul smelling?
No.
Okay, no foul. And do you have, like, is it related to your periods or do you have it all the time?
Um, well, yes, my last periods were 2 weeks back, and then afterwards it started.
Okay, so it started right after your periods. You
Yes,
mean to
doctor.
say that?
Yes,
All
doctor.
right. And do you experience any other symptoms associated with it, like vomiting or nausea, or do you have any lower
Um,
abdominal pain?
no,
Not not anything that you can
mm,
remember, or burning
nothing.
micturition.
No, doctor.
All right. That's it. Okay, how about we ask you about your sexual history? Are you sexually active?
Yes, doctor.
Are you okay? So are you in a stable relationship?
Yes, doctor.
Okay. Could you tell me about your partner? Is it male or female?
Well, he's male. Like my
Okay.
partner is male.
Uh, and do you practice safe sex? By that I
Um,
mean, do you use condoms or any other contraception?
yes, doctor. We practice safe sex always.
And your preferred route of sex, please?
Uh, yeah. What do you mean by this, doctor? Sorry.
Like,
Time.
is your how do you
Yeah.
like to have sex? Is it per vagina, or to by any chance do you use per rectal sex or per oral?
No, it's just vaginal.
Okay. And by any chance, have you used any vaginal touching or bubble baths, maybe, or any other chemicals in your
Um,
private part?
yes, doctor. I always take bubble bath. So like
Okay.
6 months back, and that is not new actually. Like 6 months, I am taking bubble bath.
Okay. And how often do you have that bath?
Well, recently, I'm using it more often, like
All right.
every two days, you can say.
All right. All right. And how about your menstrual history? Are your periods regular
Yes.
and are they painful?
No. Doctor, is it cancer?
Uh, yeah, I know you must be where you coming from and you must be concerned. But don't worry, like I can't say it right now because I'll have to run some tests and um, some examinations, and then I'll be in a better position to tell you.
Okay.
But is there, apart from whatever you told me, is there
Mhm.
anything that you would like to share with me?
No, doctor. I'm just concerned. I'm just concerned.
Okay,
Yeah.
yeah. So, Catherine, would you allow me to take your vitals that would include taking your PP, your pulse, temperature, and respiratory rate, and then after that, what I'm going to do is I'll have your examination, your abdominal examination, and your vaginal examination. Means I'll
Okay.
be examining your private part, but don't worry, I'll maintain your privacy and there will be a chaperone with you, and at any point if you feel uncomfortable or you want me to stop, you
Mm-hmm.
can always tell me, okay?
Okay. Thank you, doctor. Okay, you can go on. I have no issue.
Okay. And I would also like to take your tests, and that would include a urine dipsticks just to
Mm-hmm.
sort out any infection in your urine.
Okay, good. So
Right.
the picture shows curdy white discharge, a clear cut on examination, and also urine dipstick is normal.
Right. So, Catherine, based on the examinations and the based on the examination and investigations that we did on you, what I believe is it might be just a simple infection of your vagina. That's called bacterial vaginosis. Yeah. So early you told me you worried about it being cancer. So the good news is it's not that, right?
Okay.
It's
So how are you
just
going to treat me?
Okay, so first of all, we'll have to make some lifestyle modifications. You told me earlier that you really like taking those bubble baths, right? I think that kind be a contributing factor towards your condition, because what happens is when you use such chemicals on your your lower area, that can disrupt the pH of your that can contribute to the certain organisms or certain bugs to grow there, and that helps it grow. So what I would like you to do is to just discontinue using that. You can just wash it with normal water, and that's enough. You don't even have to use any soap or something. Just
Okay.
normal water, and that would be enough. Okay.
Okay.
Secondly, we would like to prescribe you some antibiotics so that it can kill that bugs that have actually grown. All right.
Oh,
And
okay.
you'll have to maintain the hygiene. And I think that's pretty much it. We don't really need to admit you or do anything else. Right.
Time is up. Dr. Hera, time is up. Okay. So,
Okay.
Dr. Hera, first of all, very good.
Yes, ma'am.
Like you have practiced it with me. Okay. Let's discuss it from the very start. Like in the start, you should not be get confused. You should have a proper approach. Like you said, hello, how are you? No, simply always start by introducing yourself. Hello, I'm this. Let me ask a few questions, because in the exam, even one second is very important for you. Okay. So you have to be
Okay, ma'am.
from the very start. You have to save your time. Your tone was really,
Okay, ma'am.
you are empathic, you were sympathetic. That was actually very good. Your questions were very, to the point. Okay, the thing that you missed is you missed this to ask the cervical smear, and you also missed my age. If it is already
Yes.
mentioned in the scenario, then that's fine. But if it is not mentioned in case, then you should have asked my age. You haven't asked about my age. Okay. And then you
Okay, ma'am.
45, you have to ask about the cervical smear. Like, have you had any cervical smear before? And what was the result of that? Okay. And then you mentioned, okay. So the way you ask, like with your consent and this, by saying this lot of too much, like in a very long question, a very long statement, you might, fail to complete your management part. So try to shorten this part. For example, you can simply say, well, Saira, I need to check blood pressure, pulse temperature, and respiratory rate, and I also need to do some examinations, including your abdominal examination and per vaginal examination. And for this, I'll be maintaining your privacy. Will chaperone with us. What do you think about that? Is it okay for you? Okay. Okay. So,
Okay.
okay. So, Hera, so by doing this, you are going to saying all the things in the appropriate way by also, managing your time. Okay. So be smart in the words you use. And then when you're explaining the diagnosis, then put all your time, the remaining time here. Say it properly. For example, well, Saira, on you're vitally, or you can simply say, well, your blood pressure pulse is absolutely fine but on examination I have found that there is clear curdy white vaginal discharge on per vaginal examination. So based on your sign and symptoms, I believe, or you can say, I suspect that you are actually having a simple infection of vagina, that is vaginal candidiasis, or you can say in simple words as thrush. Do you know about that? It is a common yeast, or you can say a simple fungus that commonly affects men and women and is usually harmless, but can be uncomfortable and keeps on coming back. Okay. Then she might ask, if she's not asking, then say it yourself. Well, it is non-sexual transmitted infection, but it can be triggered by sex if she's asking that concern, if she has had that concern. Okay. And then say, as you have, do you want to ask anything up till now, Saira? All right. And actually, I'm going to start you on some antifungal medicines to get rid of it. Like if you are going to give tablet, mention the tablet. If you're going to give the pastry or cream, do mention it, and also mention the time. The thrush will clear. You have to take this medicine, And then thrush will clear within 7 to 14 days of starting the treatment. And if it doesn't get better, then we might start you on some other medicine. But normally it goes away by within 7 to 14 days. But is it fine for you? And then mention very beautifully, in a very beautiful words, well, there are few things you can say, some do's and don'ts that you are supposed to do, Saira. So to get better as soon as possible for this, please try to use water and emollient instead of soap to wash the affected area. Dry properly your area, because the risk of yeast increases and when there is when the environment is moist around it. Okay, wear cotton underwear and avoid sex until thrush has cleared up. If sex is uncomfortable, but still you can say try to avoid sex because it might be uncomfortable for you. And also there are some don'ts, like do not use soaps or shower gels, because as I have already mentioned, it is one of the triggering factor in your case. And do not use deodorants on your vagina, and do not wear tight underwear or tights. Okay, so all right. And also if the patient has mentioned previously, like if you have asked, like do you smoke, do you drink alcohol, do you have any previous medical problem, then you should have addressed these things as well. For example, if she is smoker, you should mention here that and second and last but not the least, Sarah, I want to mention that smoking is not good. So you should avoid, you should quit smoking. Okay, if you find the time, do address this concern as well. Okay, and then you can offer the leaflets and ask her to come for the follow-up if symptoms does not get better. Otherwise there is no need of follow-up. Okay, so Hera, it was good, mashallah, it was really good.
Okay, thank you, ma'am.
You should just have to focus more on your management part, because in
Okay, ma'am.
they have equally divided the parts four, but for the Asians, most of the time the problem is our management part is really weak, because our whole focus is on history taking. But we should keep one thing in mind, that we have to cover the management part as well. Okay, so any question up till now, people? Hera has covered all the points, and it was really good. One more thing, people, if for example you are discussing it with the patient and the patient says, well, doctor, tell me, is it sexually transmitted infection? Doctor, is it sexually transmitted infection? Like while you were taking history and she keeps on telling you, is it sexually transmitted infection? What you are going to deal with her? Let me choose one of you who will answer this question, like how you are going to manage the patient if she says abruptly, like, am I having STI? Please tell me, am I having STI? So Dr. Naveed. Hello, Dr. Naveed, kindly unmute yourself. And for example, you are a doctor and I'm your patient. And while in the same scenario, you were taking the history and I have asked you, doctor, am I having sexual transmitted infection?
Yes, I would like to say that I do not have enough idea right now. For that, I would have to ask you a few questions. After that, I will be in a better position to tell you about it. Am I right?
Okay, doctor. So, okay. So have I got this from my partner? Is my partner cheating on me?
I have no idea right now. For that, I would have to ask you a few questions related to your sexual history, and after that, I would be in a better position to tell you.
All right. Okay, Dr. Naveed, I'll give you feedback just in a while. Any other person who wants to try? Dr. Babra. Dr. Babra, kindly unmute yourself and address my same concern. Doctor, do I have STI?
I could not say anything right now, but I have to ask some questions regarding your sexual history, and I want to do a PS examination before I can. Then I will be in better position to say something regarding STI.
All right. Okay, so Clara, kindly unmute yourself and address my same concern. Dr. Clara? Hello.
Yes, ma'am.
Please address the same concern of mine. Doctor, do I have STI? Please, doctor, tell me, do I have any STI?
No, madam. Hello.
Okay.
My Wi-Fi is.
Okay, that's fine. All right. So people, what you people have mistake, like your words are fine, but Dr. Naveed, especially if I start talking about you, discussing about your point, for example, you started you should have a very empathic or sympathetic, or you can say a sorry kind of tone. For example, your tone was not empathic. You should have an empathic tone. You should show that if the patient is concerned, you are equally concerned with the patient. So you should like just focus on my tone, that the way I'm saying. Well, I'm sorry, Clara. I can see that must be very stressful for you and under a lot of stress, but I need to examine you, and also I need to ask a few more questions so that I can see, because the symptoms you are having, there might be more than one cause behind the symptoms. So let me just ask a few questions and examine you. What do you think about that? Okay, so now you can see the clear difference. Have you seen difference between the way you delivered, Dr. Naveed, and the way I delivered, or Dr. Barbara, the way you delivered or the way I delivered? Have you people felt or seen any difference? Dr. Naveed. Guys, I'm discussing these points because trust me, I have provided you all the notes. By studying these, everything that I am mentioning here, you are going to read these from the notes. But the points that why I'm mentioning here, that's going to really help you in the real exam, because these are the punchlines. For example, in the real exam that the patient say, for example, they act properly, like you might get confused. Doctor, please tell me. You might ask a few questions. She will again say, please tell me, is it STI? Doctor, please tell me, is it STI? And that's the point where the examiner will see how this doctor at the FY1 or FY2 level is going to address the concern. So that you all, Dr. Barbara, Dr. Naveed, you all have mentioned well, like we don't know, we have to examine you, we have to ask a few questions. That is absolutely right. But the way you ask this, your tone must be empathic. The patient should know that you are actually concerned about the patient. Are you agree with me? Because if anybody of you is not agree, you can simply say, Dr. Ira, we are not agree with your point. Dr. Barbara, got it? Hello. I think, oh, I agreed. Okay. So let's move forward. So people, again, by discussing other scenarios, I will also discuss again the same points if there are some punchlines. Now, the next scenario is bacterial vaginosis. Now, who is going to practice this? I'm not going to just read the scenarios because that's not going to help you. That would be the waste of time for you people. So anybody else who wants to practice bacterial vaginosis? Dr. Naveed, do you want to give it a try? I will give everybody of you equal chance. Okay. So that would be helpful for you. Dr. Naveed, do you want to practice? Hello. Okay. So not right now. Okay. So anybody else who wants to practice, people? Anybody? Dr. Faraz, Dr. Albaz, anybody? Dr. Asma? Nobody wants to practice. Should I proceed?
Can I?
Yeah, sure, Dr. Barbara. Give it a try. So I'm going to start your timer. Okay, so just giving me a second. Let me just start it. Okay, your time starts now.
Hello, my name is Dr. Barbara. I'm the junior doctor here in GP surgery. I will attend you today. Can I check your name and date of birth, please?
Sure, my name is Catherine Smith, and I don't know my date of birth, but my age is almost 32. I'm 32 years old.
Okay, can I call you Catherine?
Yes, that's fine.
Okay. Catherine, can you please tell me what can I do for you today?
Well, actually, okay, so Dr. Barbara, again, read the scenario. Read the scenario and start it again. So it's bacterial vaginosis follow-up case. Okay, start it again.
Okay. Hello, my name is Dr. Barbara. Catherine, this is your follow-up visit, and you're here for your results, which the test which we have done in the last visit for your vaginal discharge.
Yes, doctor.
Catherine, can you tell? I want to ask some few questions.
Sure.
Is it okay for you?
Yes, definitely.
Can you please tell me what have been told in the first visit?
Well, but nobody has told me anything. Just asked me that I might be having some infection, so they did a few tests some swabs. That's it.
Or any treatment had offered
No, doctor.
in the previous visit?
No, doctor.
No. So we have your results today,
Mm-hmm.
and we will discuss these results.
Okay.
And I want to
So
tell
what
you
is
that
it? Doctor, what is it? Am I having any serious thing, like any cancer or something very serious?
no, Catherine. What the result I have, it's not positive for cancer. Do you have an infection,
Mm-hmm.
a bug which infect the vagina, and luckily I want to tell you that this is not any STI, which is sexually transmitted disease. This is a bug which cause bacterial vaginosis, a simple infection. It might caused by after taking any antibiotics, or sometimes it's happened with poor hygiene.
Okay.
And another thing which I want to tell you that this is a treatable infection. So I will advise some antibiotic which you
That's
have to use per vaginally. Is it okay?
Yes, but why do I have this infection, doctor? Because I am very concerned about it, because I am very conscious about my hygiene. I always maintain my hygiene very well. So why do I have this infection?
I want to ask a few questions. Is it
Sure.
okay with you?
Yes, sure.
What's your LMP? Means when were your last menstrual cycle?
Well, 2 weeks back.
And what you use for as a sanitary pad?
Yeah, I
How
do
often
sanitary
you change
pads.
your sanitary pads?
Sorry?
How often you change your sanitary pads?
Well, 3 times in a day.
And do you use bubble bath?
Yes, I do.
This might be a risk factor which cause bacterial vaginosis.
Mm-hmm.
So
Okay.
I suggest you to not to use bubble baths.
Okay.
Is it okay for you?
Well, okay, doctor. So how you are going to treat it? Because that is very embarrassing for me. I'm not alone. That is really embarrassing. I have not had sex with my husband for the last 2 weeks because of that embarrassing situation.
I suggest that this is a bacterial vaginosis, infection of vagina, and as I have told you, I give you an antibiotic medicine to treat this infection.
Which
treat
medicine,
this bug.
doctor? Which medicine, doctor?
It's called metronidazole, which can be used per vaginally, and you have to use for 7 days, and uh, other than this antibiotic, you should not use bubble bath and should avoid fancy items for vaginal wash. And is it okay for you?
Yes, doctor. Okay. Did I get it from my husband, doctor?
No, this is, as I have told you, this is not a sexually transmitted disease. So you should not be worried for this. And anything you want to ask, or anything you want to add something?
No, that's it. Thank you.
Thank you, Catherine.
Okay, thank you so much. All right, so Dr. Barbara, so look, there are for example, I do know. First of all, good that you did practice with me, and that's a very good thing that you people are stepping ahead, for you can say stepping forward, and you are practicing, because that is really going to help you. Dr. Barbara, the mistakes that you have made, first of all, paraphrasing, and that you did afterwards, and then you should, before explaining the result, always ask the questions, even if you know that I did some investigations. My diagnosis is bacterial vaginosis, but still you have to ask the questions before explaining results. Always ask like the 4 questions, and then further questions like, tell me more about your discharge. What kind of discharge was that? What's the color? What was the color of that? Do you have any itching? Is this the first time that you have this? Then the red flags you missed, that is very important. You have to ask.
For abdominal pain.
Yeah, lower abdominal pain. Do you have noticed any bleeding out of any bleeding? All right, and then ask about the contributing factors, because to ask that questions afterwards, and that's way your whole practice or your whole approach was really unorganized or disorganized. So you have to be organized in your approach. Then ask about the contributing factors like the sexual history, also about the use of bubble bath, and then use of any perfumes or anything new, and then also ask about the menstrual history that you have asked very well, and then ask about the contraceptive history as well, because you people know that if the person has had IUCD, she is at the risk of having infection always. We all know that. So you should have asked about the contraception. Do you use any contraception? Which one? She will say, because in the scenario she has been told that she has had IUCD. Okay, so you have to ask this. Why this is important? Because if someone has an infection and she has already she also has IUCD or some device placed in her womb, if the infection doesn't get better, then they might have to consider removing the IUCD. Otherwise that can cause in PID. So that is a very important point here. That is a punch point here that you are supposed not to miss that. And then also about the smear. You haven't asked about the smear. After 25 years of age, every female having any kind of symptom in the OBS department, gynae related issues, you have to ask about the pap smear, because that way the examiner will know, well, he or she is a safe doctor. She knows the basics. She actually knows the basics. Okay. And then you should have mentioned the examination as well, Dr. Barbara. And then management, always have points in your mind. For example, on examination, I have found that there is a discharge, that is whatever it is, greenish or yellowish. And based on your sign and symptoms, I believe that you have a condition that is bacterial vaginosis. It is a kind of infection that is caused by a bug that is very common in the females. Then take a gap, let the information sink in. Then she will ask afterwards, what is it? Why am I having this? Then again, explain it that it is an overgrowth of normal bacteria that lines the vaginal wall. So when vagina loses its acidity, or you can say the pH increases, the normal bacteria of the vaginal wall multiplies, overgrows, and then cause this condition. That is why you are actually having smelly vaginal discharge. Are you following me? And then ask about the management. For the management, what I am going to do is I need to prescribe you a medicine that you are supposed to take it for the 7 days. Okay. You should start from the tablet. If she says, I don't like tablet, then you can say that we can also offer you a gel for 5 days. And then say that if it does not improve, then we might have to refer you to the specialist. Okay. But before mention do's and don'ts, well, there are a few things that we can do for you, Saira, and there are a few things that you can do for yourself. But I am going to do is I am going to prescribe you this medicine. And what you are supposed to do is there are some do's and don'ts. Use water and plain soap to wash your genital area, because that is very sensitive area. And have showers instead of bath. Okay. Are you following me? Because you have to engage the patient and then tell about the don'ts. Okay. And then same that you have to avoid this, and then the patient might ask that one thing more, people, very important here, you should know that metronidazole has an interaction with alcohol. So never miss the thing. Do you smoke or do you drink alcohol? Because if the patient drinks alcohol, you have to mention that point is very important here, because if you drink alcohol while taking metronidazole, you might develop severe symptoms like this, and this. Okay. Are you following me, people? Should we move forward? This is all you are supposed to do. Okay, G. So next scenario is.
Could you ask for HPV vaccination with smear?
You can ask. By the way, you can ask that. Have you had any previous vaccination related to HP? HSP.
Human phenomena
You can
virus.
ask. You can ask. You can simply ask. Yes, you can ask for sure. That is a good point, actually. I missed it. That is a good point. Okay, so Dr. Barbara, you need to practice more and more, okay, and try to avoid the unnatural pauses. And what you can do to avoid this, keep on practice with the people, read the notes carefully, and then keep on practicing with different people. All right. Okay, so the next scenario is gonorrhea. Anybody else wants to practice, people? Anybody wants to practice? Now it is the sexually transmitted infection, and that is very important how to approach it. So anyone, please do practice, people. Otherwise, that won't be helpful, because I think the Dr. Barbara and Dr. Hera, as they have practiced with me, they might have learned more than you people. So please do practice. Anybody? No one wants to practice. Dr. Faraz. Hello. Dr. Faraz, kindly unmute yourself. Hello. Anybody else, people? All right. So if you don't want to practice, then okay, let's move forward. Then the next scenario is, okay, so the next scenario is gonorrhea. You are FY2 doctor in genitourinary medicine clinic. Now where you are already in the genitourinary clinic. A 24-year-old lady came to GUM clinic 1 week back to be tested for STI. The results are back from the laboratory and shows that the patient is positive for gonorrhea. Take the sexual history and discuss the management with the patient. Now the patient info is, you are 24 years old lady who came for STI 1 week ago. Okay. Now there are two scenarios that can come. One is, she saw a TV advertisement about STI. She's in a new sexual relationship for 3 weeks and has had 2-3 sexual partners in the last 6 months. She is married. Now, the scenario B is, she had these symptoms. New partner in the last 3 weeks. She was in a relationship for 5 years before and broke up 1 year ago. She's not married now. And the D is, you are reading on and the same, like it can present in different way. Now, the patient concerns are, did I get it from my partner? Very important question. Where did I get it? Is it curable? I do not have problem in telling my partner about the diagnosis. Can I tell him? Are there any complications? Which antibiotics will you give? What treatment will you give me? How long do I need to take antibiotics? And are there any complications? And how common are the side effects? So all these, you are supposed to know all answers to all these questions. Now, the patient has already been there, so you are going to paraphrase it. I understand that you came to the hospital to be tested for STI 1 week back. Am I right? And now I believe that you are here for the results. Has anybody explained it to you? She will say no. Okay, so let me ask a few questions so that I can explain it very well later on. All right, so then ask about the questions like, what kind of symptoms were you having? For how long have you been having these symptoms? Anything that has make it worse? What was the color of it? What was the odor of it? What was the amount of it? And then about the red flags, like, have you had any lower abdominal pain, any nausea? Have you noticed any blood coming out of vagina? And then sexual history is really important here, because you, as you can see, the information that the examiner or the examination system has provided to the patient, you should have asked all the questions on your own. Otherwise, patient will not answer you anything on their own. So you have to ask a detailed sexual history, then menstrual history, then contraception history, then again PMMA, HO family, smoking, alcohol, drugs history, recreational drugs, anything. Okay, and then ask about, complete your rest of the history and ask, do you have any idea what the results could be? And or do you know, do you think what's going on? All right, so always ask. And then ask, do you have any particular concern? And then mention that's totally up to you if you want to do examination or not. Okay, so you can do the abdominal and pervaginal examination, but you can also miss it. It's totally up to you. And you need to mention the test, because in the scenario, pregnancy test has not been done. So you are supposed to do the pregnancy test here. All right. And because she is doing unprotected sex, so she might be pregnant also. So you have to ask that and then explain. Now, I have a question here. Okay. First of all, how you're going to explain it? Unfortunately, I'm really sorry to say, but the results are not good. The results show your tone must be very low. Unfortunately, Sarah, the results are not good. The results show that you have a sexual transmitted infection, that is gonorrhea. Let it sink in. And then it is basically a sexually transmitted infection gotten from unprotected sex. As you have told me that you have had multiple partners previously and you have had unprotected sex. So it is one of the risk factor for STI. Are you following me? Then I'll discuss it with my senior as well. She will ask, is it treatable? Yes, the good news is it is treatable. What will you do for me? Well, what we are going to do is we need to start you on a medicine that is a single dose. And also, we also need to run a few more tests on you, but with your consent. What do you think? Like, we think we need to do some screening for hepatitis B, C, and HIV as well. Are you okay with that? Then, did I get it from my partner? Now, first of all, I want to ask you people how you are going to address this point here, because that is a very sensitive question. Did I get it from my partner, doctor? Anybody answer? Let me choose one of you, Dr. Sudhan, I guess. Dr. Sudhan, can you please address my concern? Did I get it from my partner?
Why do you think so like that?
Because I don't know. I just want to ask, as you have mentioned that it is sexual transmitted infection. So my partner might be cheating on me.
Mostly it's not that case. Most of the times these bacteria can be there for a long time without causing any symptoms.
Okay.
So we can't exactly say it may be the reason. It is possibly due to that you could have acquired from the previous partners, or maybe your partner could be have acquired from the previous partner as well. So it doesn't mean that he's cheating on you. Am I making sense?
Well, okay, doctor. Okay. Good. So, Dr. Sudhan, that was good. All right. So, how we're going to deal with it, like the way that Dr. Sudhan has mentioned. Very good, Dr. Sudhan. That's the way actually. A lot more things like you can say, like you can simply say, well, it is first of all, signposted. Well, unfortunately, it is a STI, and which means you could have gotten it from your partner, because we can't give any vague question like, no, your partner is not cheating on you. We can't say this. And we also can't say this, yes, your partner is cheating on you. No, be sensible in your replies, or be sensible in your treatment, in your what should I say, in your the statement. Well, unfortunately, it is an STI, which means you could have gotten it from your partner, but you have had more than one sexual partner, so it could be from any of your previous partners as well. Okay, so we advise you to discuss this with your partner, as your partner needs to come to get tested. And also we might need to trace your sexual partners in the last 6 months, because the bug can live in the body without causing any symptoms for a quite longer period of time. All right. And then she will ask, will you disclose my info to them? Well, your privacy will be maintained. We won't share your details, and you can give contact details of your partners. And so we can invite them for testing and treatment, because that is very important. Okay, so the next thing would be lifestyle modification. So what lifestyle modification you are going to give people? Anybody? How you are going to say these words? Anybody, please? Everything is mentioned on the screen. I just want to text you to check your tone or the way you tell them. Dr. Naveed. No, Dr. Naveed, Dr. Asma. Please tell me how you're going to tell. Hello, people. Anybody? Asma? Yeah, Hera, you can try. Give it a try.
You can say, I know you must be really worried and where you come from, but there are a few things that you have to do in order to avoid this infection from spreading. One of them is to avoid intercourse until unless you tested negative. We have given you the medicines. We'll repeat your test, and after you negative, it's advisable to avoid sex in order to spread it to your partner. And secondly, you have to practice safe sex. That means you should be using condoms.
Okay. And do I really need to tell my husband about that? Because I don't want to share it with him. I don't know what he might think about me.
Yes, I know it must be a bit uncomfortable for you, but I would advise you to talk to him, because as I told you, it's a sexually transmitted infection, so he should know about it so that he can avoid it. Maybe it's the infection does not come from him, so I think it's his right to know and to be safe.
What if I do not share it with him? Because I think that would be with my consent. But if I still do not share, still do not share with him and get
Well,
treatment.
we'll encourage you to share with him, but if you don't, then unfortunately we'll have to inform him through partner information service, and so that he's safe, or it's safe for him.
Okay, thank you, Doctor. Dr. Ed was really good. Very good point. So the landing point is if the patient is not agree to break the news regarding the STIs, that is very important to break the news to their partner. First of all, encourage them and then tell them the pros and cons. For example, if even if she is not getting it, you can simply say, well, I can understand, Sarah, that must be very stressful for you, and I can understand why are you reluctant in sharing with your partner. But you should know that your partner's health is your priority, and as you have been diagnosed with it and you have been in sexual contact with your partner, so he is at the risk of catching the infection, and this infection has had some complications as well, and it can spread to the other people as well. Are you following me? So you and your husband's health is our priority, so that's why we need to do this. Are you following me? What do you think? Will you inform your partner now? If still she says no, then say, well, then unfortunately I'm really sorry, then we have to ask the patient notification program services, and they will inform the partner, because this is a rule and we cannot ignore that, because that is not good for your partner's health and as well as for the society. All right, so you have to cover these points very sensibly. You have to cover it, and you should know that the partner must know about the effects, because these infections do have some complications as well. Okay, now the safety netting would be lower abdominal pain, fever, vaginal discharge, and then follow up in just 2 weeks time to repeat the swab to make sure infection has cleared. So in STIs, always you have to call for the follow up to repeat the swab in STIs, but in non-STIs, there is no need. Okay. And also, if in case the patient, all right, I think that's enough. That's it. Okay. So the next thing is acute pelvic inflammatory disease. It is the same as we have discussed above, same history. Let just read the scenario. So you are foundation year 2 doctor in the emergency department. Now where you are, oh yeah, the point I was about to mention previously, that if you were not in genital urinary clinic and you were in the GP clinic and you did this test and the patient has been diagnosed with gonorrhea, how you are going to deal with it? The most important point in the management would be, I am going to refer you to the genital urinary clinic. So when you are either in the emergency department, or when you are in the gynae department, or when you are in the GP surgery, if the patient has been diagnosed with STI, you have to refer them where? Genital urinary clinic. Okay. Now, the next thing is acute inflammatory disease. So your foundation year 2 doctor in the emergency department, a 30-year-old lady who has presented with a lower abdominal pain, take a focus history, perform the relevant examination, and discuss management with the patient. So the patient history is, you are Mrs. Nicola Edison, a 30-year-old lady who presented to the emergency with a lower tummy pain. You had right-sided pain for 3 days. Its severity is 8/10. You felt sick, but you do not vomit. You have also noticed foul-smelling greenish discharge for the 5 days. You are sexually active and also has IUCD. You are in a new relationship. Your partner has no symptoms. You feel hot generally, but you do not check the temperature. Questions: what is wrong with me? How will I be treated? Where did I get it from? Did I get from my partner? Is it something you can cure? Are there any complications? And will I be able to get pregnant? Now, again, this is very new. Here you know that it is something PID, but in the real exam, you won't know, is it PID or is it something else? What could be the DDs for abdominal pain, people? It could be appendicitis. It could be pancreatitis. It could be simple related to your stomach, like gastritis, acute peptic ulcer disease, you can say, or it could be anything else. So you have to ask about all these symptoms, or it could be simple infection. So you have to ask you should know, you should have the DDs in your. So from where you gonna start it? You're gonna start from the very start. Even if while standing outside the cubicle, you know the scenario, you should not be sounded scripted. And how you are going to avoid it? Ask from the symptoms. What symptoms are you having? She will say, I am having pain. Then say, show sympathy here. Well, I can see you are in pain. Do you want me to give me some painkiller? All right. She might say, yes, doctor. Or in the most of the cases, she will say, no, I'm fine. I'm able to answer these questions. If she says yes, then say that I need to ask a few questions before giving you some medicine to see if it is suitable for you. Are you allergic to anything? Have you taken any painkiller before? Just by asking these two questions, then offer. Okay, then I'll request my staff and nurse, and she will give you painkiller in a while. That's it. By doing this, you're going to save your time. So whenever the patient presents with the pain of any kind, do mention painkiller after asking about the asking about any use of previous medicine, painkiller, or any allergies. Then thus questions where exactly the pain is. Can you show me with your finger? When did it started? What were you doing when it started? Was it sudden or gradual? Has it become continuous or did it stop afterwards? Has this worsened, got better, or stays the same? Does anything make this worse? And does anything make it better? And what kind of pain it was? Does the pain go anywhere else? Could you please score your pain for me? You have to ask all these questions, because by doing this, you are going to rule out a lot of diagnosis. So what my DDs are: PID, female, pain, do PID. Have you noticed any discharge from your vagina? If she says this, ask about the questions about discharge: color, amount, odor, consistent with periods or not, for how long. Then nausea, ask about the nausea. And then for rule out other symptoms. Do you have any burning micturition? Because UTI can present in this case. Has you noticed the pain has been referred, like from where it started previously? Because in the appendicitis, the pain starts around the umbilicus and then moves on the right iliac fossa. So you have to ask this. In the start, can you tell me from where the pain exactly started? Okay. And then ask about, have you done any procedures on your front passage previously? Have you had any history of painful periods? And then ask about the periods history. How are your menstrual periods? Are they regular? Do you have you had do you have heavy bleeding? Do you plaster clots? And do you have any and then ask about the ectopic as well, like when was your last LMP? Because the patient, lower abdominal pain, young female, sexually active, it could be ectopic, so you have to ask that. Okay. And then about the sexual details, sexual history, contraception history. And also ask here, when you are asking about the sexual history, right after asking about the partner, do ask about, do your partner has any kind of symptoms? Okay, so people, can we just wait for 5 minutes? Azan, let's just listen to Azan, just 5 minutes. Okay. Okay, so thank you so much for your cooperation, people. All right, so now what we are going to do is what are the DDs? You have to rule out the DDs. After asking about the main symptoms, save your time and just a few questions from the DDs. Just one or two questions from each DD that are important. Okay, and then about the menstrual history, that is very important. Sexual history, contraceptive history, again very important, because IUCD or IUS are one of the risk factors for PID if the patient get infection while having any kind of device in her womb. So you have to ask that. If you miss this point, then you have made a blunder. And then complete the remaining history, PMA, family, depending upon the questions that are relevant. For example, what questions I can ask: are you allergic to anything? Do you have any previous medical problem like any diabetes, blood pressure? Are you taking any medicines? And then what can I skip? I can just what can I skip? I can skip family history. But I need to ask is, do you have any previous hospital stays for the similar condition? And do you smoke? Do you drink alcohol? There is no need to ask how is your diet, how is your mood, how is your sleep. No need of that. And then travel or occupation history, definitely it is important. And also, where do you live? What do you do for living? And if the history now the history is really short, no need to ask how this has impacted on your life, because that is extra question here. And then you have to mention blood pressure, pulse, temperature, respiratory rate. You need to mention abdominal and per vaginal examination, because the examiner will give you the finding that is tenderness on this, and on the pelvic examination this kind of discharge here. So if you will not mention this, they will not give you any finding. Then what tests are very important here? If they have not been done previously, urine dipstick and pregnancy test. Why pregnancy test? Because ectopic, you have to rule out ectopic. Ectopic is a red flag here. So you have to ask about pregnancy test as well. So what the examiner will give you, there is a right iliac fossa tenderness. Then you have to explain it very in a proper way. Well, Saira, you are actually having the symptoms that is this, and on examination, I have found that there is tenderness on your right iliac fossa or in your lower abdomen. And based on this, I believe that you are actually having an infection of the womb, tubes, and ovaries, which we called it in a medical term as pelvic inflammatory disease. Do you know about that? All right. And then explain it. It is commonly caused by sexual transmitted infections such as chlamydia or gonorrhea. But right now, we do not know which bug is actually causing it in you. So what we need to do is we need to admit you under gynecology department. Is it okay for you? I will inform my seniors as well. And also we need to run some investigations, including ultrasound, to check if there is any pus in your womb, and also some swabs to identify the bug, and also some routine blood tests, some inflammatory markers, and also your special blood test to check if the bug is in your blood. All right? Is that okay for you? Then she will say something, side by side, and then you have to address the concern side by side, and also tell her what we are going to do is, after admitting you, we will start you on antibiotics, and we might consider starting it through IV line. And we also give you some medicines to control your temperature if the patient says that temperature is high. Otherwise, no need to mention. And Sarah, after admission, most of the scenarios, she might have concern, doctor, I don't want to get admit. Then what you are going to address that? Shit. Okay. Hello, anybody wants to answer that question? Hello? People, am I audible to you? Hello?
Yeah, man, you don't want to get admitted?
Sorry. Yeah, doctor, I don't want to get admitted because I have 2 kids at home and there is no one to look after them.
Oh, I can see that you are caring for your kids and you are looking after them.
Yeah.
But let me tell you, as I told, this is actually a condition which should be required to be treated in the hospital.
Okay.
So what I am going to do for you is that possible that I would suggest you to call your friends or relatives to take care of your kids?
No one is here, doctor. There is no one in
Hmm?
this city.
All right. So we will try to arrange someone, if possible, and we will try to arrange some temporary accommodation for your kids to be taken care. How does that
Okay.
sound?
Well, I think that's fine. That's good. Thank you.
Okay. So you're okay to get admitted?
Yes, definitely. Thank you.
Okay. Thank you. Okay.
Very good. Very good, Dr. Siddhant. That was a point. So whenever the patient you ask about, I need to admit you, do ask, is this okay for you? And then if she says no, then do ask why. And then address the concern. If in most of the scenarios, patient might have concern that I have to look after my kids, then offer this, that the way that Dr. Sudan has mentioned, that first of all, do you have anybody who can look after your kids? No. Then what we can do is we can arrange a temporary accommodation for your kids. How does it sound? Okay, and then explain again here, whenever the patient is having some kind of STI, we have to offer the patient the screening for other infections. What? HIV, Hep B, Hep C. So in a very low tone, do ask, well, as you are having STI, so we are we will suggest you to get screened for other infections as well, like hepatitis B, C, and HIV. So but with your consent. What do you think about that? Okay, so your tone must be very empathic when you are asking for this. And then tell her, well, as you have IUCD, and if the infection is severe, the seniors might consider removing it as well. But this would be after their assessment. Then if she'll say, can it be cured? Then same. Yes, it is a curable condition, but once the diagnosis is confirmed, because right now we are not confirmed with the diagnosis now. So we have to say that once we identify the bug and the diagnosis is confirmed, we would need to test your partner and treat him as well, because these infections are keep on coming back and there is a risk of reinfection. All right. And then complications, same. And the concern of the patient was, doctor, will I be able to get pregnant? So what you are going to answer is, well, one of the complications of STI or sexually transmitted infection is they can cause infertility, but with the use of the proper treatment, we can prevent it. Okay, that's it. So your answer must be, if you do not know the right answer, your answer must be like kind of political answer, we can say, like a kind of just give some statement that that you are not going to be an answerable for. Okay, so always be very conscious with your statement you are giving to the patient, and do not offer leaflets because you are going to admit the patient. That's it. And here involving senior is very important because this is something serious. Now the next scenario is PCOS. So this is a simple question paper. So you are referred to the GP clinic. So where you are in the GP clinic. Mrs. Kim, age 29, has come to the GP surgery with the complaints of acne and amenorrhea. On her first visit, pregnancy test was done and was found to be negative. Her hormone profile was done and it is this, and this. Okay. So discuss the test with that. Take the appropriate history and discuss management and address her concerns. So now, the patient info is she has been gaining weight since 1 year. Also noted excess hair on the face. Period stopped 6 months back. Before that, periods were irregular, not sexually active, not on any regular medication. Question, what is PCOS? What medication will you give? And is there any herbal medication available? Now the thing is, patient is, now anybody wants to give it a go. Dr. Sudan, I think you should practice this and then we will discuss the approach. Hello? Dr. Sudan, do you want to practice this scenario?
Yeah, I can try. Yeah.
Just let me give 2 minutes. Let me just start the timer. Okay. And your time starts now.
Okay. I can start?
Yeah,
Or
you can. Your timer.
Hello.
Hello.
I'm Dr. Hari. I'm one of the doctor in this GP clinic. Is this Mrs. Kim?
Yes, doctor.
All right. So I can see from my notes that you are here for your results. Am I right?
Yes, doctor.
Okay. But before we discussing your results with you, I would like to just have some chat with you. Is that okay?
Sure, doctor.
All right. So could you tell me that why you did this test at first instance?
Well, doctor, I don't know. I was gaining weight since the last 1 year, and the doctor told me that they might need to run some tests. That's why.
All right. Okay. So for the past 1 year, you are having this gaining weights.
Yes.
Have you noticed along with that?
Sorry?
Have you noticed any other problems along with that?
Like what, doctor?
Like any problems in your periods?
Well, my period stopped 6 months back, and before that, the periods were really irregular.
All right. So how long you're getting this irregular periods?
Well, before 6 months, like you can say almost 1 year back, I started having irregular periods, and then I do not have period since the last 6 months.
Oh, okay. So after that, have you consulted anyone, like any GP visit you did for
No,
that? No.
no,
Okay. All right. So are you taking any other medications like any contraceptions or anything like that?
no, doctor.
Okay. Okay. Have you had noticed any excessive air in your areas where it should not be found?
Yes, I noticed excess hair on my face.
Mm-hmm. Okay. All right. So any other things that you have, any concerns that I should be aware of?
Just tell me, why am I having these, doctor?
Okay, I'm going to share the results with you. But
Okay.
before that, I just want to know, we used to ask all the standard questions to all. So please
Uh-huh.
don't get worried about this. Are you sexually active?
Well, no, I'm not sexually active.
All right. Okay. Thank you for letting me know that. Okay. So here is the result. This result shows that there is hormones. There is some mild changes in the hormone levels, where there is LH and FSH hormone, where the LH hormone is raised, which indicates that you could be having a condition called polycystic ovarian syndrome. Do you know what that means?
No, doctor.
Okay, let me explain to you in simple terms. It is a fluid-filled cyst. That means it's a fluid-filled cavity in your ovaries. Kim, do you get me what I'm saying?
Well, yes, doctor. So how you're going to treat it? Like how you're going to manage it? Because is it something serious, doctor?
All right. I can see that you are concerned about this, but let me tell you, this is a very common condition which happens to most of the reproductive age group who are going through this hormonal condition. As I told you, that this is a normal fluid-filled cyst which impairs that our normal ovaries to produce the egg, which is capable of producing proper egg. Am I making sense?
Well, yes, doctor. Yes, I'm getting it. So will I be able to get pregnant in the future?
Yeah, you have all the chances, equal chances of like other movements, but this condition actually requires only lifestyle modification.
Okay.
Do you want to discuss further more about that?
Sure, doctor.
Okay, all right. So as you told me that you have a lot of weight gain, and also you told me there is some excessive hair growth. These all are because of a hormone called testosterone, which increases because of this condition.
Okay, doctor.
So for to reduce that and also to have a good effect on this, we
Mhm.
request you to start doing exercise regularly.
Okay. That's it, doctor.
And also you told me that regarding this weight gaining exercises, we also send you to a weight reduction clinic. They will
Mm-hmm.
also give you some plan for you, and
Okay.
also they will ask dietitian for you. How does that sound?
Well, that sounds good.
All right. Other than that, we will also like you to follow up after a few months to check how you are reducing your weight and how you are coping with that.
Doctor, I have one concern. Actually, can I have some herbal treatment? Because I don't want to take these hormonal medicines or some other, because I think herbal medicines are going to work more.
Unfortunately, Kim, we can't say how much the herbal medications have this impact on this condition. You know,
Mm-hmm.
these medicines don't have any scientific guidelines, or they don't have any proper scientific support, so that
Okay.
we can't comment on that whether it will impact or in this condition, how it works.
Okay. Okay. Thank you, doctor.
Moreover, okay, Kim. Moreover, it will also cause some interactions what you are doing. So it's better if possible that we would suggest you to go more on this lifestyle modification. What do you think about that?
Well, I'll love to follow that because I want to get well soon.
Okay, okay, Kim. So we will also give you some leaflets so that you will have a better condition, better picture about this condition.
Okay. Thank you. All right. So, Dr. Siddharth, it was good. You have covered most of the points, but there are a few things that we still missed. For example, scenario is very clear in front of you that it is the PCOS case, but still we have to confirm it. So, first of all, we need to ask questions like same, presenting complaint, and all the other questions related to PCOS, all the symptoms. You need to ask all the other. For example, first of all, start with the menstrual history, everything that the Dr. Sudan mentioned. When was the last LMP? But how were your periods before that? Were they regular? Were they painful? Were they heavy? Did you pass? Have you passed the course previously? And when did you have your first periods? Okay, and then ask about the additional symptoms like have you noticed any hair growth in the areas that is not supposed to? All right, and how do you have acne on your face? Never miss that point. Do you notice any acne on your face? And then if she says that, do ask about the change in the mood, a change in the weight. She has already mentioned that I'm gaining weight. How much weight have you put on? Do ask that as well. And how is your mood? Because if she's is gaining weight and she's having acne, that these are the risk factors for having low mood or depression. So you should have asked them. And then still, even if you have the reports with you, you have to rule out the other DDs as well, just to be on a safe side. Just a few quick questions regarding hypothyroidism. Do you have cold intolerance? Like, do you feel like you cannot tolerate the cold? All right. Do you have any headache or any visual problems? Have you been using any steroids recently? And have you noticed any purple discoloration or purple lines on your abdominal skin? Okay, so just a quick review because these things can also present that way. So to prove that you are a safe doctor, you need to just for 1 minute you have to just ask a few quick questions from these DDs, and then again to ask about how here the dietary habits, the lifestyle is important. So you have to ask the DESA as well. Like ask about the family. Do you have any similar history in the family? Do you have any history of cancer in your family? Do you have any previous medical problem? Are you on any medicines? Are you allergic to anything? And then do ask about the diet, exercise as well. Because why? Because you are going to address that concern in the management plan, because the main treatment is lifestyle modification. So before that, you have to ask that how is your lifestyle mode, like do you do exercise? If she says this, then how long? Then like how much and how frequently? And then ask about the diet as well. And then here what we have missed is Dr. Sudan is we have to mention the examination. What examination is important? Face, neck examination, because hypothyroidism can present in the form of the weight gain. So you have to you rule out that. You have to also mention the abdominal examination and general physical examination as well. That I just missed to write here. So you have to mention these as well. And the examiner might say everything is normal. Just proceed, continue, and then explain. Now, the very good way to explain the results is they give you a picture and they will give you a page in which the test results will mention. What you're going to do is, actually, I'm really sorry, I cannot show you my video, but you can like say simply put the paper in your hand and show the patient, well, Sarah, as you can say here, this hormone and the normal value is this, but your hormone level is raised, and the second one is this and its value is also raised at this, as you can see. So based on your test results and based on your symptoms, like you have mentioned that you are gaining weight and your diet is good, still good, but and you are also having hair growth, I suspect that you have a condition that is PCOS. Like speak it completely, like you have polycystic ovarian syndrome. Do you know what is it? Then explain that it is basically a condition in which you have fluid-filled sacs in your ovaries, which affects the function of your ovaries. That shows that you have a hormonal imbalance, which actually causing you all these symptoms. Okay. and then address her further concerns. So what I'm going to do is, at this point, we need to confirm the diagnosis still. So we are going to refer you to the specialist who will do a scan of your ovaries or of your tummy. And also, we also need to run a few more tests to rule out the other possible causes of this condition as well. Like we need to do your cholesterol levels, and also we need to check how your thyroid is working. Is that okay for you? And then mention, as I'm going to refer you to the specialist as well, what they are going to do is, they might, after the confirmation of this, they might start you on hormonal therapy. But again, the most important thing for the management point of view is lifestyle modification. As Sarah, on your previous visit, we did measure your BMI. Do you know what is BMI? Well, BMI is actually a measuring in which we see if the patient has an ideal weight according to his height. So in your case, your BMI is slightly high. That means you have extra fat on your body. So that is also one of the contributing factors towards the PCOS. So we have to work on it. So what we are going to do is, first of all, there are few dietary modifications that you have to take. Always try to have a balanced diet, avoid spicy or oily food. And also what I can do, I can refer you to the dietitian who can give you a proper dietary plan. What do you think about that? All right. And then explain that you also supposed to, or you need to do some exercise as well, because that's going to really help you in getting better of this, out of this symptom, out of this disease. Are you following me? And then the patient might say, I don't want herbal medication. That's the same. Well, I can see that for some people, taking medicine is not, they don't like to take medicines, but there is a lack of scientific evidence on the role of herbal medicine in the treatment of the PCOS. And also, we are not sure, because not a lot of research has been done on herbal medicine. So they might have a lot of side effects that we don't even know. So I can't recommend you herbal medicines right now. All right. And then she might ask about the complication. Do tell them. And also mention that if the patient says, I have low mood, offer that I can also refer you for talking therapy. If the patient says in the history that I have low mood, then mention that. Okay. And then the safety netting is chest pain. Why chest pain? Because the PCOS one, there are the complications, like it can cause obesity, cardiovascular risk, psychological issues, infertility. So keeping in view the cardiovascular risk, the safety netting is chest pain. And also say suicidal thoughts. If the patient mood is low, you can say, if you have any suicidal thoughts, you can come to us on urgent basis. Okay. And offer leaflets. That's it. The next question is premature ovarian phase if insufficiency. So it is the same, almost the same that we have discussed before, same. So you are referred to the OBS and Gynae. Sana, age 26, presented with amenorrhea. She had some tests done. Results are as follows: FSH, LH high, estrogen low. Diagnosis of premature ovarian insufficiency made. Talk to her, explain the results, and address the concerns. Okay. So the patient's questions are, will I get pregnant? And what is this condition? Again, you will paraphrase it. You will ask 4 questions. As the patient has premature ovarian insufficiency, you have diagnosed it by seeing the results. You have to ask all the questions related to that disease, and also the complications. Do ask about the complications as well. So how we are going to start is paraphrase. Ask the 4 questions. Ask about the detailed menstrual histories. Ask about if she said that I do not have the periods, and ask when previously you had the periods, how were they? Regular, irregular, heavy, painful. Then at what age did you have your first periods? Then ask about the other symptoms of premature ovarian insufficiency. Do you have night sweats? Do you have vaginal itching? Because in the premature ovarian insufficiency, patient develop vaginal dryness. So you have to ask them. Okay. And then ask about the sexual history. If she is sexually active, then ask, do you feel pain while having sex? But if she says that she is not sexually active, then you are not. For example, if you, before asking the sexual history, if you ask, do you feel pain during the sex? She will get offended. She will say, I'm not sexually active, doctor, but you are saying. So you have to be very vigilant about that where you are supposed to ask which question. Okay. So first ask about the sexual history, then ask, do you feel pain or intercourse? Okay. And then the complications, because premature ovarian insufficiency, because estrogen goes low, so it can cause complication like cardiovascular problem and osteoporosis. So you have to ask that the symptoms, like do you have any chest pain, any shortness of breath, any pain in your bones? All right. And ask for the other contributing factors, like Ask, for example, the other contribactor, by that I means the other DDs of the symptoms. You need to rule out the others as well, because behind any symptom there could be more than one causes, so you have to rule out the important ones. Do ask about the thyroid, ask about the, do you feel like you have cyclical lower abdominal pain that starts right before your period starts? Then do you have any headache and visual problem? Have you noticed any discharge of the milk from your nipple? All right, do you have any previous exposure to the radiations or any history of chemotherapy? And then ask about the exercise and diet as well. Like, do you do exercise? She might say yes. Then how much and how often? All right. And how is your diet? Do ask. These questions are really important here, because not having periods can be triggered by doing too much exercise or being on strict diet. Okay, so then can you complete the rest of the story, rest of the history? Not all the questions are important, but do ask the relevant one. And then here the family history is very important, people, because premature ovarian insufficiency can run in the family. So you have to ask the family history, because what we are going to say is, by any chance do you have similar history in your family? The patient might say, I have a history of this in my mother or in my sister, so he will mention. And then on examination, the important thing is weight, general physical examination and weight, because BMI, estrogen, the change in the hormonal levels do have impact on the weight. So you have to ask them. And then management. So you will explain the same results by showing the picture to the patient. So here are your hormones. Your this hormone is high, your his hormone is low. Unfortunately, this hormone is produced by ovary. So based on your sign and symptoms, I believe that you have a condition that is premature ovarian insufficiency. By that I means your ovaries have failed earlier than you should have. As you have told me that your mother had POF, so unfortunately this puts you at the risk of developing premature ovarian failure. Then let her sink in. She might cry, keep on looking for her body clues. Then we need to run a few more tests to rule out the other causes, like mentioned that some blood tests to check a few hormonal levels in your body, your routine blood tests, and also your pelvic ultrasound, where how does it sounds to you? All right, and then say that I will discuss it with my seniors as well. We might need to start you on hormonal medications. And also there is very important thing is lifestyle modification. And one thing that I just kept it, you have to ask about how this problem has impacted on you, because she's not having periods for the last 6 months and she's having all these symptoms previously. So she might have some kind of impacts on her life. If she's married, if she says, like when you ask about the family, because here the family history is also very important. After menstrual history and sexual history, do ask, are you married or do you have any partner if she's sexually active? Do you have any kids? All right, how many kids do you have? What is the age of the younger one? Do ask these questions. Okay, and then come to the other points, like discuss it that we might start you on the hormonal medications. You need to modify your lifestyle. For this I would recommend you do yoga and go to gym to relax yourself. And also you can also join some other relaxation therapies. You can try some relaxation therapies, and also try to have a healthy diet and go on a walk on daily basis. Okay, and if she mentions that my husband is not happy with me, and because I'm not getting pregnant, so I'm very disturbed, you can offer her counseling. Well, as you're upset, I can see that is very problematic for you, and I can understand your condition. What I can do, I can refer you to the talking therapy, and they will help you to feel better. If she mentioned that my husband is not good with me, then you can recommend them to refer to counseling and sport group, couple counseling and sport group. Okay, you can also mention the name of the one, that is the Daisy network. Okay, and then offer the leaflets. And also safety netting is chest pain and the low mood. Now the next is premenstrual syndrome. The premenstrual syndrome is, as you all know, that the symptoms start before the period, so you have to ask the symptoms. For example, so the scenario is you are referred to the general practice. A 32-year-old lady wants to talk to her and address her concerns. What will she say? She will start with, well, doctor, my husband says that I'm not myself. Then ask, first of all, I'm really sorry to hear that. Please tell me, why do you think your husband thinks about that? Then ask about her mood. She will start, well, I'm having this. He says that I'm irritable. Ask, when did it start? For how long do you feel that you are irritable? All right, for how long you are feeling like that? And how did it started? Is there something that has happened before? Have you noticed anything that has worsened? Have you noticed anything that makes it better? Does anything have you done yourself to make yourself better? Then ask about the DDs. Okay, so for the premenstrual syndrome, is it associated with your periods? Do you get the periods? Are they regular or irregular? Is it associated with your periods? And then does your mood improve after the periods are over? Do ask these questions. Then do ask about the thyroid, because you have to rule out the DDs. Do you have heat or cold intolerance? Any change in the weight recently? Have you lost interest in the things that you used to love? Do you feel loss of energy? Because all these questions are related to low mood, and you have to ask them. Low mood, irritability. So you have to keep these points in your mind. And bipolar disorder, do you feel high in energy at times? And then red flags, very important. Do you have any suicidal ideation, or do you have any thought of hurting others? Okay. And then complete the rest of the history, like menstrual history and sexual history. You can ask, but that is not very much important here. You can just ask 1 or 2 questions, and then complete rest of the history that is relevant. And also again, examination, GPE, thyroid examination, and how it has impacted on you and your relationship. Do ask this question. And then the management. So the management part is very important here, because first of all, the patient has just come with this. So you have to first of all confirm it. How you're going to confirm it? First of all, break the news. Well, it is from what you have discussed, we suspect that you have a condition called premenstrual syndrome. It's a common condition in which, due to hormonal fluctuations, women tend to experience mood swings and angry outbursts, especially before the periods. Okay, so what we need to do is, you need to keep a diary of the symptoms to confirm the diagnosis, not the symptoms that you get, at which day of the month and when does it stop. Once confirmed, we might consider starting you on hormonal therapy. All right. And also we need to adopt some lifestyle modifications, like go on a walk on daily basis, eat balanced diet, have a good sleep, don't smoke, and reduce drinking. Mention these last 2 points only if the patient mentions in the history that I do smoke and I drink. Otherwise, if he or she is not drinking or smoking, then you are not supposed to say it. Otherwise, you sound scripted. And she is feeling low. I can also do one more thing for you. I can refer you for the talking therapy. In this, they will talk with you and they will let you learn the ways to relax your brain. How does it sound for you? Then offer the leaflets and do safety net for low mood and suicidal ideation. And then follow up in 2 months. Okay. Now, the next scenario is very different, and it is very that is very easy one, but also that is very different one. So that is a very simple scenario, that is invitation for cervical smear, but it is very different from the others that we have discussed before. So in this, basically the person, let me first of all read the scenario for you. The FY2 in the GP surgery, a 25-year-old has been invited for the cervical smear screening. She has some concerns. Talk to the patient and address her concern. Patient info: I'm just wondering why I have been invited for pap smear. I don't know what is the pap smear. I think they sent me the letter by mistake. And what she's a lesbian. She's otherwise fit well. Question: why did they call me, and what is the procedure like? Then what you are supposed to do is, first of all, paraphrase, because this is a consultation and you already know that you people have sent the cervical smear and she is here to discuss it. So paraphrase: I understand that you have been invited for the cervical screening. I understand you have some concerns. I am here to talk and address your concerns. Please, let me know, how can I help you? Then she will say, well, why am I invited for the pap smear, doctor? I think you might have made a mistake. Then you have to explain. I will explain about it, but before that, can I ask a few questions? Then start from the very beginning. Like, do you have any symptoms? Ask about the symptom. Do you have any discharge? Have you noticed any bleeding from the vagina? Have you noticed any weight loss? Then sexual history in detail. Each and every inch of the sexual history important here. Are you sexually active? Are you in a stable relationship? How many partners do you have? Is your partner male or female? What is your preferred route of sex? Your tone must be definitely empathic and very low tone. I'm just teaching you. That's why my tone is like that. So is your partner male or female, and which route you prefer? Like, which kind of sexual route you prefer, oral, anal, or vaginal? And then ask about, do you use toys? If she is lesbian, then you ask, do you use toys? And then ask about, let me ask, what is your understanding of the pap smear? Because you have to ask that. And then the other histories like previous medical problem, any family history of cancer, are you allergic to anything? How is your diet? And do you smoke? Do you drink alcohol? If she says smoke and drink alcohol, then do ask about the recreational drugs. There are a few questions that we really need to ask for your safety. So do you do recreational drugs by any chance? Okay, so you have to signpost that because that is very sensitive question. And then ask, explain. Well, what is pap smear is, it is basically to check for any cancerous change in the females. This is done for screen for the precancerous condition. By that, I mean to check for the abnormal cells that have the risk of developing into the cancer. Cervical cancer or cancer of the neck of the womb is caused by a bug. This is sexually transmitted infection and you can have the virus without any having symptom. Sharing of the sex toys may also cause this viral infection. In the UK, pap smear or cervical smear is offered to all the females between 25 to 50 years of age 3 yearly. Now she can say, okay, so how is it performed? Then you have to mention it. It takes about 10 to 20 minutes for the whole examination and it is done in the clinic and the results will be back in 2 to 3 minutes and it is not painful procedure. It is a very simple procedure. Okay. Then if in the previous history she has mentioned, yes, I do have discharge, then it is obligation of yours to mention the examination that I have to examine you. Okay. So ask about the further concerns and then address them accordingly. Okay. And that's it. And ask her if you give me consent that we can proceed with it. What do you think about that? She might say, well, I will let you know. Then say, okay, then once you decide, let me know, we can have a visit later on. All right. That's it. Arrange a visit later on. Now, the next thing is contraception. Okay. So this is the last scenario for us, the contraception. So for contraception, you should know that these scenarios are very different from the other ones, like very, very different actually. So these scenarios will come in a way like the patient will ask about the proper contraception for them. So there are few points, few areas that you are supposed to cover for the contraception. So let me discuss it with you. So the scenario is you are referred to the GP surgery. Louise Parson, 30-year-old, has made a routine appointment to see you. Please talk to her and address her concerns. So the patient info, you traveled to Australia 1 year ago by the air and afterwards you developed the leg swelling. That means she has had DVT. Hence you were started on blood thinner. You tried using condoms, but you got pregnant. You want to know the failure rate of each contraception method. You have 2 children with a stable partner. You like idea of COCP, but doctor says it is not okay. Then you will be fine with that. You are a non-smoker. No medical or allergies. Not last pap smear was 1 year ago, and that is fine. I want to know about the contraception. You are in a relationship and he does not want to use condom. So you have to mention that. And the questions are, what are the options for me? What is the failure rate? And ask for each of one. Are there any side effects? Which one is better for me? So that is how it goes, like the contraception scenario. So first of all, always keep it in mind. Whenever the patient comes and asks for the contraception, do ask, like, let me ask a few questions so I can see which one suits you the most, because the best type depends on your health, on your circumstances. So let me just ask a few quick questions. Okay, is that okay for you, Saira? Then ask, first of all, start from the contraindications or the risk factors. Do you have any history of the leg swellings? Do you have any problem of the left half-sided headache? Do you have a history of clot formation in the lungs? Any history of blood pressure? Have you had any heat or cold intolerance? Do you have any problem with the liver? Do you smoke? Because these all the contraindications for the use of combined oral contraceptive pills. So you have to ask them. Then take the detailed history of menstrual. So starting from contraindications of risk factors, then menstrual history, then sexual history, then family history. Family history is also important here because once you are going to prescribe any contraception, you should know that for how long she wants the contraception. So you have to know, do you have kids? How many? Have you completed your family? And for how long do you want protection? And then ask about, have you used any contraception before? What was that and for how long? All right. And then ask, is there any particular one contraception you want to know about? And then ask about the rest of the question that you haven't asked. And then again, the concern, and do ask if is there anything important that I have missed so far. Let me Just let me know. And then on examination, same blood pressure, pulse, temperature, respiratory rate, general physical examination, examination of the legs and the BMI. And then also do pregnancy test here if the patient's LMP was delayed, otherwise not. And then discuss the management. So I can understand that in this scenario, the management is very long, but we might not have the time. So what we are going to do is we are going to shorten the time from the history. Shorten your history from the previously. The risk factors part very important. So complete that. Ask a few questions, just 1 or 2 about the sexual history, the menstrual history, and then just 3 to 4 questions from the remaining history, and then comes to the management part. Okay, so that's where you have to manage your time. And then you're discussing the different options. You have to learn the failure rate of different contraception, and also disadvantages and advantages. Just 1 or 2 quick points. Okay, and also after explaining every contraception, you have to ask that how does it sound to you? What do you think about that? Okay, so do engage the patient with you during your whole conversation. So Saira, there are 2 types of contraceptions available. The one is the permanent and the other is a temporary. Let me discuss the temporary ones with you. All right. So there are different ways, like you can have pills, you can place patches, you can get injections, you can place devices, and some barrier methods as well. So let me discuss one by one. So that would help you to choose from them. Okay. So pills are of 2 types. Like one is the combined oral contraceptive pills. Actually, it works by stopping the ovulation, and it is supposed to be taken 21 days of the whole cycle, and it actually releases progesterone and estrogen. The good thing is the periods become regular and less painful, but it do have a few side effects, like it can cause headache, nausea, and it cannot prevent sexual transmitted infections. And also there is a risk of thrombo, or you can say clot formation in the lungs, and also it can cause stroke. So, and also in your case, as you have mentioned that you have a history of previous clot formation in the legs, so that is not recommended for you. And the failure rate is 3 ratio 1000, 3 in 1000. Okay. Then the next is mini pill, like progesterone only pills. And the good thing is it does not cause clot formation, but the disadvantage is it can cause like irregular bleeding, and the failure rate is 3 in 1000. And also one thing more regarding the pills, you are supposed to take the pills regularly on the same day. You have to be compliant to get the full results of that. Now the next option is pill syrup. What the patch is, sorry, a patch will be applied on the arm on weekly basis, and it will release the hormones on your blood. The good point is, once you place the patch, you don't need to take any medicine. But the bad thing is it can cause itching, soreness on the side of the patch, and also it can cause breakthrough bleeding. Okay, and the failure rate is 3 ratio 1000. The other option is implants. Once the implant is placed, the good thing is you don't have to think for 3 years. It is basically a small rod placed under the skin of the arm, and it releases the hormones in the blood time to time. And it is a very good way to control to conceiving. But the disadvantage is it can also cause irregular bleeding and acne, and it also do not save from the sexual transmitted infections. And the failure rate is 1 in 2000. All right, what do you think about that? Okay, so the next is Mirena coil. You must have heard of that. That is very common way in the UK for the contraception. It is basically a device that will be placed in the womb, and it works by both mechanical and hormonal blocks. And it protects for the 5 years, and it prevents implantation, and it is really good. But it is most effective way, you can say, and lot of people I have seen in my practice that they use this method for contraception. The advantages, periods become less painful, but disadvantages, it can cause irregular bleeding and the periods, and also it can by having device in the womb, there is a risk of getting infection of the womb as well. Okay, so what do you think about that? And then tell about the copper. Well, there is another one, that is copper. It is basically a device that secretes the copper, and it works by both mechanical and hormonal block, and protects up to 5 years to 10 years. And the advantages, it will help with the painful periods, but the disadvantages, it can cause infection of the womb. If the person gets pregnant, the pregnancy can be outside the womb, and it can cause perforation in the uterus, and the failure rate is 2 in 1000. And the remaining is Depo-Provera. It is basically an injection you are supposed to get every 3 months. And for this, again, you have to be very compliant with it. Otherwise, that might not work. And it works by preventing the ovulation. The disadvantage is heavy bleeding and acne, and the failure rate is 2 in 1,000. What do you think about these options available? As I have mentioned, Sarah, COCPs are not for you. And from the rest of the options, you can choose what you want. All right. So she for sure, she will reply something. And then tell about that there are some, let me tell you some permanent contraceptions as well. That is female sterilization and the male sterilization. In females, the part will be removed of the tubes. And the disadvantage is irreversible and the failure rate is 1 in 200. All right. So these are the options. What do you think about that? Okay, she will say something. Okay, doctor, I will go with this. What do you recommend for her? Then you can offer that. You can go with the patches. You can go with the devices. You like according to the scenario, you will recommend 1 or 2. Like these are all safe. You can do that. But remember, the only way to protect yourself against a sexual transmitted infection is to use condom, because all the other methods are not going to protect you from STIs. All right. And then tell her, if you miss a period, even if being on contraception, please take a pregnancy test immediately and see your GP. And then the patient will say, okay, thank you, I will consult my partner and we'll get you back. And then say, see you soon, have a good day. That's it. Okay. All right. So now the next is the last one, is repeat contraception. Basically, the scenario is a patient is already on contraception pills and she wants a contraception prescription again. So the patient scenario is you are FY2 in GP surgery. Patient is 26-year-old and has made an appointment for repeat prescription. Talk to her and address her concern. Patient info: has come for prescription of OCPs, is okay, doing well on her contraceptives, wants her periods to stop. No history of migraine, no history of clots in the legs or the lungs, no medical history, no allergies. Questions: I'm leaving the country for 3 months. Can you give me prescription for 3 months? Is there any medication to stop my periods? That's it. So now what we are going to start is ask about, paraphrase, ask about the history of contraception, which one is using for how long and how does she takes the pills. Then ask for the side effects. Have you noticed any acne on your face, any weight gain, any mood swings? Then ask about the contraindication or risk factors we have asked before, like DVT, migraine, pulmonary embolism, thyroid, all the questions we discussed before. Take a detailed history of menstrual cycle, and then sexual history, family history, like for how long, how many kids, and why do you want the contraception again. Do ask that, why do you want that? Okay. Then she will mention, I want this because I'm traveling for 3 months. Then do mention, if you want to stop the periods, what you need to do is to take the combined pill continuously without a break. As you have told me that you are taking 21 pills right now and taking a break of 7 days to stop the period. After you have completed 21 days, start the new pack immediately. Do not take the dummy pills. Do not take 7 days break. After you come back from the holiday, you want your periods back, you have to do is to take 7-day break after 21 days. That's way you will get your periods back. And then just give the prescription. That's it. Okay. And one more thing here. Well, you have to mention here, I just missed here that you have to mention that, but Miss Saira, you have to keep one thing in mind, that you are not supposed to take more than 2 7 days free. Sorry, you are not supposed to take more than 2 COCPs patches back to back, because otherwise they might have some side effects as well. So you have to mention that you can only take 2 combined oral contraceptive patches side to side, but do not take more than 2 side to side, otherwise they might have some side effects. Okay, please, but I will recommend you, please do confirm that point as well from the other site as well. And that's what I remember. That's it. Okay, so that was what you are supposed to say and what you are supposed to cover in the stations related to your gynae. So do you have any concern up till now, people? Hello, do you have any concern? No, thank you. That is the end of our today's session. And I believe I have cleared myself. Still, if there is any mistake in the notes or any kind of mistake, please do correct it. And I tried my best. And thank you so much for your cooperation, and wish you people good luck. And do let me know if still you have any queries. I'm available for you people 24/7, and you can text in the group, or you can also text me personally. Thank you. Okay, so I'm going to end the meeting, people. Thank you so much for your cooperation. You people are so cooperative. And one thing is, please do practice, do maximum practice, and do not be reluctant, be confident. Okay.